All right, welcome back to Rehab Renegade. So if you're starting to have what you think is bicep tendon pain, you got to be careful because that might not be what's going on. A lot of times you can have other muscles that are referring to that area. So sometimes when you go into a physician's office, they'll go and they'll press around and you'll be like, yeah, that's pretty tender right there. And the automatic assumption is, that's bicep tendon related. So that's not a very accurate test. So you need to be careful with that. Sometimes that'll cause people to send you to get imaging, x-ray, MRI, and they might actually find something. But just because there's a little bit of wear and tear there doesn't mean that it's your pain source. Okay, so the first two muscles we're going to talk about are the subclavius and the pec. So the subclavius runs between the clavicle and the first rib. It's a little bit tough to get to, but you could probably get in there with a finger or a ball. And the second one we're going to work on is the pec. So both of those can refer pain to the front of that shoulder. So come on over this way. So for the pec, it's pretty easy, right? We're going to get the hand behind the back. We're going to apply some pressure into the pec. From here, you're going to search around. The goal is to find a spot that's tender and maybe even something that reproduces pain to the front of the bicep or the bicep tendon. Right, so I find a spot there. What I usually do is I'll go through contracts where I tighten up the muscle about 5 to 10 seconds and then I relax and sink in. From here, I'm just going to cycle a couple deep breaths. So in slow, out slow, and I'll let the ball sink in. From here, I might actually go in and start working around a little bit. So for the most part, you can kind of freestyle, but take a couple minutes, go through those contract and relaxes, go through just working it out like a little self-massage, and then you can move that ball up a little bit and do the same thing right underneath the clavicle. All right, so the next muscle is the scalenes, right? And those run right in the front of the neck, the side of the neck. So what you'll do is you get a ball, okay? Or you can take your hand and you can start working through these muscles in the front, right? Sometimes if you go and hold your breath or you cough, you'll feel them poke out into your hand. You don't have to be too specific with this, but take the ball, you can roll in, you can even do a little twisting technique, something you'll see from the mobility WOD crew. And then from here, you can go into some light stretching, right? But like I said, you can also take the fingers and do a little self-massage. So the next muscle is the infraspinatus. That could also refer to the front of the shoulder or the bicep tendon region. It runs right along the top of your shoulder blade. This one's a little bit tougher to get to, but what you can do is you take your ball. If you reach back here, you can feel on top of your shoulder blade. You'll get the ball set up. You'll pull your shoulder over, and right now I'm getting that ball right on top of the shoulder blade. From here, I'm going to search through and try to find a spot. You are going to roll over some bone, so try to get it in a meaty spot. See if you find anything that reproduces that shoulder pain. You may even get some referring pain down the arm. Once you find that spot, same thing. Try to contract the muscle, 5 to 10 seconds, and then relax and try to sink into it. Cycle through a couple deep breaths. Feel like that ball sinks in a little bit deeper. You can repeat that for a minute or so, and you can also go through and just try to work that spot out like a little self-massage. So if you're having some shoulder pain, there's a lot of spots that could refer to that area, but the obvious one is your deltoid, okay? So kind of a hard one to treat on your own, but what you can do is you can run your fingers right across those fibers, so they'll run like this. So as I'm strumming across, I'll feel those tight bands of muscle. I might find a spot that's a little bit tender. What I can do from there is I can take a ball, right? So and I can set it up right on that spot. So I'll go through, put as much pressure as I can tolerate. From here, I can contract that muscle or get that muscle to tense up. I'll hold that for about 5 to 10 seconds. From there, I'll just try to sink a little bit deeper into that spot. I'll go through some deep breathing, trying to feel like that ball sinks in. I can repeat that for about 1 minute to 2 minutes, or what I can also do is I can just give myself a little massage. I can work up and down those muscle fibers, or I can work across them. After that, what you can do is go in and try to get a stretch. Right, so don't pull all the way across. Try to get a little bend in that elbow and just feel like you're really localized stretching to that deltoid. Right, so you can take about 1 minute to 2 minutes to do that and see if that helps with some of that shoulder pain. So now the last one that might refer pain to the bicep tendon region seems a little bit obvious, but that could be the bicep. So you go through, right, and you start pressing around. So you can pull that muscle right off the bone, right, and you can kind of feel along it. See if you have anything that causes some tenderness, which you might, and see if it also reproduces pain in this region. So you could go through and do a little self-trigger point treatment here, and what I would recommend is you find a spot, right, you apply enough pressure, right, I'm squeezing between the thumb and the finger, that you can tolerate, And what I'll do from here is I'll contract the muscle, about 20-30% effort for about 5 to 10 seconds, and then I'll relax, and I'll try to sink that thumb in a little bit deeper into that spot. I'll hold pressure for about 20-30 seconds or so. You can cycle some breaths with this one as well. All right, and you can go ahead and keep repeating that. The other option is you can take your ball and you can start working it in this way. All right, so same thing, about 1 to 2 minutes of trying to work that out. What you can also do from there is you can go into a nice light stretch for the bicep after you're done, about 1 to 2 minutes or so, and that should hopefully help.